Hello, friends. Welcome back. I'm Dr. Vrinda Kumar, and welcome to my channel where I talk about allergies and immunology and related diseases. And this is all for the information of patients. This is all non sponsored, non promotional, and genuine allergy and immunology related information. So, in today's video, we're going to talk about what to do if you have a lot of food allergy related anxiety. Food allergy is difficult. It is a cause of a lot of anxiety for a lot of us. If we have a food allergy, we're always scared when we go out, when we're eating something from outside, and especially the fear is of anaphylaxis or a very severe allergic reaction, which can cause throat closing. It can cause like sudden circulatory collapse, so it can cause you to pass out, and it's a serious allergic reaction that may lead to hospitalizations. Or if you look at recent media reports, there have been actually two cases of death because of anaphylaxis in the past few months. So that is kind of where the fear stems from, and I think that the fear is very real, especially if you have a food allergy, and life must go on. So you do go outside, you do eat things from outside. It's very limiting to just like rely on always cooking your own meals and always relying on that. So the fear is very real. And then let's see, I'm going to discuss like two or three ways to decrease your food allergy related anxiety. Of course, therapy and cognitive behavior therapy is one way, but this is going to be more from an allergist perspective. Okay, number one, find out if your allergy is actually real. So, a lot of times we assume that we have allergies without actually the reaction to the food actually being an allergy. So, in another video, What is Food Allergy? I discussed how a food allergy is a reaction. It can be like just hives, which is small red bumps on your face, on your body, or it can be difficulty breathing, it can be sudden shortness of breath, it can be like a sudden like pain in your belly, need to go and void or have a diarrhea immediately, or passing out immediately after having a food. It usually starts 15 to 30 minutes after having a food. And if it comes on later, like the next day, a couple of hours later, it's unlikely to be a food allergy. A lot of times we eat some foods and we don't feel good. So a lot of times, say I eat gluten, I eat something that contains gluten, bread or pasta, and then I feel bloated and I feel a headache. That means that I might be intolerant to gluten, that I my body doesn't really agree with it. But that doesn't necessarily mean that it's an allergy. So allergy is a very specific immune reaction to a certain food, and intolerance can be because of a variety of reasons. So to not confuse between allergy and intolerance is important to decrease your fear, because if it's intolerance, then that usually does not is not related to anaphylaxis. The allergy is related to anaphylaxis. So if you're concerned about allergy and anaphylaxis and death, and that is like the cause for your anxiety, then separating true allergy from an intolerance can actually alleviate you of some of your anxiety. So to find out if your allergy is real and not, see if your symptoms match the symptom profile that I've mentioned. The other thing you can do is get yourself tested. So visit a nearby allergist. If you need a list of nearby allergists, you can always go to the American Association of Allergy, Asthma and Immunology, AAAAI, or American College of Allergy and Immunology, ACAAI website, and you can find an allergist nearby. They can test you, so they can test your skin or your blood for that specific allergen and find out if you have an allergic reaction, so immune mediated reaction to the food. And if you find out that you don't have an immune mediated reaction, you have an intolerance, that it doesn't agree with your body, you have bloating or you have headache, or it just doesn't agree with you, you can avoid it. Definitely continue to avoid it, but it will decrease your anxiety of an anaphylactic reaction. Okay. Number two, the second thing you can do is, if you do have a real allergy, say you have a real allergy to peanut, egg, milk, soy, fish, shellfish, make it a habit to read labels. Reading labels is going to be your lifesaver. So whatever you consume, anything you buy from the store, read the labels, read whatever is the ingredient on it. Usually the first and the second thing are what is in the most quantity, but anything is given, all the ingredients need to be listed by law in the label. And even if you're eating something that you know will not have that particular substance, for example, you're eating potato chips, you know it's not going to have peanuts, but still if you make it a habit to read labels, you will not miss it. So don't make it a cognitive habit. Like, don't make it a cognitive thing that, okay, I have a peanut allergy, so I'll read a label if I think that this may have peanut. No, make it a habit. That will also reduce your anxiety because you know that you have a habit of reading labels, and you will anticipate any allergen before it encounters you. So make it a habit of reading labels, make it a habit of letting people know that you have allergies at restaurants or when you're going out to eat. That way, if you know that that's a habit, then you'll rely on it, and that will decrease your anxiety. Number three, what you can do is always, always, always carry your EpiPen. You should have an EpiPen prescription. An EpiPen prescription usually does not last for a long time. Max is like 1.5 to 2 years. Usually only 1 year. By the time you get the actually pick up the prescription from the pharmacy, it's usually only good for a year. So have an unexpired EpiPen with you at all times. Carry it with you. Carry it on yourself, and that will reduce your anxiety because the just having it, and you know that you'll have it in case you need it, you feel like you can do something, you feel in control. You don't feel like, I might go somewhere, I might encounter something, and I'm going to die. So at least that part of your anxiety will decrease, that you have something, you have some control. EpiPens, you can get them, or you can get them different types. So this is like the EpiPen brand name. Know how to use it. Remove the blue cap, point blue to the sky, orange to the thigh, and then click and then hold for 6 seconds. There are other types. This is like a generic EpiPen. This is also available. This is usually cheaper. This is, you pull both sides of the EpiPen, remove it, and then uh, pull both sides again, and then this is where the needle is, and then you go. You won't hear a click here in the generic one. And then there's a new type of EpiPen. This is called OVQ. So OVQ is an EpiPen that talks, is an epinephrine auto injector that talks to you. So you remove it.
This trainer contains no needle or
This
drug
is a
and is
trainer.
for training purposes only.
So
Do
you
not use place black end against outer thigh. Then
So-
push firmly until 2, 1. Training complete.
so it talks to you. So if your kid
This
has an
trainer may
allergy,
be reused.
and you're scared that they might not be able to use their EpiPen, you can ask for an OVQ to your allergist, and they can give them an OVQ, because that's more like user friendly. So always carry an EpiPen, know how to use an EpiPen. For more information, I have a video specially on how to use an epinephrine auto-injector. You can refer to that. So that helps you. The fourth thing you can do is, especially for children, have a buddy. So have a buddy, have a friend who knows about your allergies, and whenever you're going outside, and they also remind you to read the labels. Sometimes they can also read the labels for you, let the waiter know that you have so and such allergy, know where your EpiPen is, know how to use it. So if you have a buddy who you can rely on, that also decreases some of your anxiety. I hope this video was helpful. Please leave any feedback in the comment section. Tell me what more you want me to make videos about, and looking forward to meeting you next time.